So my name is Melanie Clark. All three of my children have been patients of growing faces since my oldest was 4 or 5. He's 13 now. All three of my children have done the ALF Appliance with Dr. Hillel, and additionally they've had regular dental cleanings and whatnot. My overall experience here has been wonderful, and for my children as well. I never would have guessed that children so young could go through this type of therapy and handle it completely fine, but I've been really pleasantly surprised at how well they've adapted and adjusted to all of the appliances, and obviously astounded by what it's done for them health-wise, physically, obviously aesthetically too. And then when we first started seeing Dr. Hillel, she explained to me what was going on with, at that time, my son's craniofacial development, his face, his airway, very importantly, and it all went from there. The ALF Appliance has helped all three of my children in particularly profound ways. Not only has it expanded them laterally to allow for all of their teeth to come in and not be overcrowded and have enough room, it's helped them with proper tongue placement, also obviously airway. Another issue is at least 2 of my children had some sort of compression in their faces, which of course you can see it as a parent, but you don't really know how to describe it or have the words to understand what it is that you're seeing that looks like different, and Naomi picked up on it right away. She explained to me what it was and how the ALF was going to help and essentially open up their faces, and it did, and essentially has given them the faces that they were supposed to have as they're developing. One of my daughters was diagnosed with mild sleep apnea. She no longer has it. She now, since quite a young age, maybe since she started with the ALF, I think at 3, and at not long after, maybe by 4 or 5, she was sleeping very solidly through the night. My youngest one actually got a ton of ear infections. As a baby, she was very close to having to have tubes, and once we got her in an ALF, gone. This is what I should have been doing as a child, and had the doctors and orthodontists and dentists around me had the knowledge that Dr. Hillel has, I would not be at my age going through palate expansion and orthodontia. So I know what I'm doing for my kids is helping their lives and mine.